Good morning, and thank you so much for joining us. I am here with my friend, Dr. Kevin Ferentz from GBMC, the Owings Mills location. Family physician, we're talking about depression today. It is something that affects so many people out there, and we hope that you will tune in to our Facebook live stream and ask any questions that you have for Dr. Ferentz. We'll be talking to you. We want this to be really interactive and for people to feel comfortable, because sometimes there's a stigma attached to depression.
Unfortunately, with all mental illness, there's a terrible stigma. People tend not to go to their doctor and say, I need to make an appointment because I think I have a mental illness.
Right.
So even when they come to us, we sometimes have to figure out that the physical complaint that the person is complaining about is actually due to a mental illness.
And I would imagine sometimes a lot of people just don't know that that's what they're coming in for either, right?
Incredibly, to make a diagnosis of depression, you don't even have to be depressed. There are two major criteria for depression, and one of them is just not having fun. It's called anhedonia. So a person actually doesn't even need to say, I feel depressed, to actually meet criteria for depression.
Interesting. Well, what is criteria for depression?
So there are 9 possible symptoms when people have depression, and we ask them about these symptoms. So it's things like sleep disturbance, anhedonia, are you having fun? Do you feel guilty about yourself, right? People who feel depressed feel guilty about feeling depressed. They feel bad about themselves. How's their energy level? Do they have difficulty concentrating? How's their appetite? Have they lost weight or gained weight? Do they have something called psychomotor agitation or psychomotor retardation, which is people who are walking slowly, talking slowly, or who are agitated, who are picking at their clothes and playing with their keys, or just having difficulty sitting? And then the last thing is suicidal thoughts, so we have to ask them about that as well.
All right, I want to just log on here and see. We're going to be very interactive, so if you have any questions, like I said, feel free to tune in and write them to us. So I'm going to be checking in every now and then and seeing if we have any questions. But we will move right along. So you were saying millions of people are affected by depression.
Over the course of a lifetime, almost 1 in 5 people will experience an episode of major depression. In any 1 year, it's almost 7% of the population will experience an episode of depression. So it is indeed tens of millions of people who are depressed in the United States every year.
Is this something we're born with?
Well, that's a good question. So the question is what makes it more likely that you may have an episode of depression? So unfortunately, picking the right parents is an important thing. So if you
always tell me that. We have to pick the right parents, right?
Pick the right parents. So if you have a family history of depression, so that's parents, siblings, or children, that doubles your chance of having an episode of depression yourself. So there's a genetic issue. There's also stressful life events can precipitate an episode of depression. Unfortunately, having bad stories, trauma stories, having been physically abused or sexually abused, increases your chance of depression. For some people, this time of year, just being in the wintertime and not being exposed to enough sunlight, that precipitates episode of depression, something we call seasonal affective disorder. So, and sometimes it just happens. It's a common human experience.
Really? Toby, we want to thank you for writing in. Toby's question is there a difference in signs with adults and kids?
So, very good question. Yeah, it's much, much harder to make a diagnosis of depression in kids. Kids can't express their emotions the same way that adults do. And so in children, it's often behavioral. It's not doing well in school, being reserved, more reserved, and not playing with their friends as much as they used to, and not showing interest in things. That's behavioral problems tends to be the way depression presents in little kids, especially. In adolescents, it's more like adults. They can usually be able to express their emotional issues.
Is anxiety a symptom of depression? Is it its own thing? When we talk about anxiety and depression, what is the difference?
2 totally different things.
Okay, two totally different things.
So anxiety, first of all, is a symptom. It's not actually a diagnosis. So you can have a symptom of anxiety, of feeling on edge, of feeling worried when you're depressed. But anxiety is usually a symptom of an anxiety disorder. And there are a number of anxiety disorders. Panic disorder, generalized anxiety disorder, people who are just born anxious. That's what I say, they've always been worried about things their whole life. Post-traumatic stress disorder, that's a form of an anxiety disorder. Obsessive-compulsive disorder. There's an acute stress disorder right after you've had a bad thing happen to you, you're in a car accident or something bad happens to you, and you relive that event. And so those are the common anxiety disorders.
How can you tell the difference, I'm sad, I'm in a bad mood, versus somebody who really has depression and needs to seek medical treatment?
So, speak up. Okay. So, to make a diagnosis of depression, people even online can do this. Okay. The diagnostic criteria for depression, the way we do it is with a scale that's called the PHQ-9. And if a person is thinking, gee, am I just sad because my boss is a jerk? Or am I just sad because I'm in a bad marriage? Then you can actually do your own PHQ-9. You can Google it. It's on a million different websites. And it will actually give you a score that will tell you whether you meet criteria for depression or not. Then, of course, you need to go see your family physician or your doctor, and then we'll figure out what it is that needs to be done after that.
Okay, Matt, thank you for writing in your question. Matt's question is, what can be done for a 20-year-old diagnosed with depression but will not take the prescribed medicine? He or she continues to show signs of depression, but they don't want to take the medication.
So it's a very common problem. Psychotropic medication, things like antidepressants or anxiolytic medication. There are a lot of people who just don't want to take them. There's a stigma associated with taking these medications. So if this 20-year-old is living with you, you actually have some ways of getting your 20-year-old, like car keys, right? That would be a big one. You try to use positive reinforcement to get a person to take their medication. And in adolescence, sometimes we use negative reinforcement. We say, unless you take your medication, you can't go out tonight. So those are some of the things, but in my experience, if you really explain how much better a person will feel if they take their medication, what I try to do is I tell people, let's forget about that it's depression. Okay, let's forget about that I'm giving you a pill for depression, but you tell me that you're really tired, or you tell me that you're really not having any fun, or you tell me that you can't concentrate. How about if I give you this medicine to help you with that symptom? And forget about the fact that you think that it's a mental illness. Right? That's the way I've done it.
Okay. Are there other treatments besides medication? I mean, I've heard, a lot of people are into this holistic approach now. Is there other things that can be done, or is medication really the main form of treatment?
It's not the only way to go. It's not the only way to go. So clearly, there are people who are depressed who need psychotherapy, right? Obviously, if you have issues in your life that are distressing to you, you should go talk to a therapist. And one of the great things about GBMC is that we're in a grant that is putting mental health professionals actually in the offices. They are integrated into the primary care offices at GBMC, which is something that we're really very excited about, because I could be seeing a patient who needs to talk to a therapist, and I can say, well, as it turns out, I have a therapist right down the hall from me. Let me grab this therapist and you can talk to them for a little while. So that's very positive. What the literature says is that with mild depression, exercise is actually as good as medication is.
Really?
So clearly people who are mildly depressed who can exercise should be exercising. And the more depressed you are, the more you need medication. And the more depressed you are, the more you need both medication and psychotherapy.
Okay. So if you are diagnosed with depression, is that something that you will have from that point on, that you will have to continually treat, or is it something that it just can happen in spurts?
Yeah, so the average episode of depression lasts for about 14 to 16 weeks, so it's around 4 months if you don't treat it. And most people will actually get better, but without any treatment, but we actually don't recommend not being treated, because sometimes you'll do something, you'll hurt yourself during those 16 weeks. So most depression goes away with treatment. And then after the first or even second episode of depression, we just treat it for 6 months, 9 months, and then we stop the treatment. But if it keeps coming back, and unfortunately about half of the time, you will have another episode of depression. And after 3 episodes of depression, the likelihood of you having another episode is greater than 90%. And so for those people, we'll usually recommend long-term treatment, sometimes lifetime treatment.
For someone who's depressed, are they more likely, do you see that people diagnosed with depression are more likely to dabble in drugs and alcohol to try to ease the pain?
It's an excellent question, and the answer is absolutely yes. There are many, many people who use drugs and alcohol to self-medicate their depression. Not a good choice, because because alcohol is actually a depressant. So people may feel good for a little while, but then actually they usually feel worse. So alcohol and drugs are not the best option for you, but it's actually seeing your doctor and going on an antidepressant medication.
For moms who maybe have suffered from postpartum depression, does that increase their risk of regular depression?
Unfortunately, yes. If you've had an episode of postpartum depression, you are at increased risk for having another episode of depression as well when you're not postpartum. And unfortunately, women are more predisposed to depression than men are, about twice as often. And it's women in their childbearing years. So they're very often, you'll have a person who has a postpartum episode and then will have an episode when they're not postpartum.
And does that go the other way too? If you have been diagnosed with depression, are you more likely, once you have a child, to have postpartum?
Not that I'm aware of,
Okay.
no. I don't think having an episode of depression necessarily predisposes you to an episode after you've had a baby.
Okay. Let's see. Going back to anxiety, what did you say actually causes anxiety?
I wish I could tell you we knew what caused any of these things. Yeah.
Yeah.
Our brain is a very complex thing, and it's very hard to study. Unlike any other organ that we can take a piece of and look at it under a microscope, you can't do that with your brain. You can't take a piece of somebody's brain. And so we're just really starting to learn about what causes mental illness through very sophisticated techniques, something called a functional MRI and PET scanning. And what it's showing us is which areas of the brain light up when a person has a problem. But what's actually happening on the cellular level, we're still very much in kindergarten about that.
So someone who suffers from depression, anxiety, would their brain look different than someone who does not?
So there are many studies actually that have shown that that's exactly the case, that there are certain areas of the brain in people who have recurring depression that are smaller than in patients who don't have depression.
Michelle, thanks for writing in. Michelle would like to know, what are some tips for sudden anxiety episodes?
So one of the things is reading a self-help book, right? So if people have panic attacks, and that's usually what they're referring to, sudden onset of really significant anxiety where you can't function, you don't want to go out, you start withdrawing. So for panic attacks, there are a couple of really wonderful self-help books that have been written. The one that I usually recommend to patients, they were written by an Australian psychiatrist named Claire Weeks. And she has 2 books. One's called, terrible title, Hope and Help for Your Nerves. It was written a long time ago, so you wouldn't give the book that title now, Hope and Help for Your Nerves. And she also wrote a wonderful book called A Simple, Effective Treatment for Agoraphobia. Then there are drugs also. There are medications that we can use to help people with panic disorder.
How can I stop anxiety from affecting my job?
I would tell you, my wife's a psychotherapist. She has a wonderful line that she gives to patients, which is, be afraid and do it anyway, right? Just because you're anxious at your job doesn't mean it has to affect your job. And I would say that that's a good area where talking to a therapist would be the right way to go.
Yvette, I believe that's your name. Thank you for writing in. And I know I asked this question moments ago, but I think she missed it. So what really causes anxiety? You were saying we're not quite sure.
We just don't know. What happens on a cellular level? Clearly, anxiety also runs in families. Clearly, if you've had a traumatic episode in your past, physical abuse, sexual abuse, bad relationships can trigger anxiety as well.
PTSD. Some people have some questions about PTSD. How can we destigmatize PTSD? What should you not say to someone who is suffering from that?
Well, I mean, the most important thing to say about PTSD is that when you hear PTSD, you think veterans, right? You think shell shock, you think that kind of trauma, but actually the most common cause of PTSD is sexual abuse, is having been sexually abused. And up to 30% of women, I mean, that's what the data says, about 30% of women have been sexually abused at some point in their lives. I guess maybe the best thing to tell a patient is to never minimize what they're experiencing. You know, one of the worst things we ever tell people is, don't feel that way, or you shouldn't feel that way. But actually, you are 100% able to feel whatever it is that you feel, all right? You should never minimize what somebody is feeling. And for people with PTSD, seeking therapy is a very important thing to do. And there are very effective medications for treating PTSD as well.
Okay. Robbie, thanks for tuning in. He would like to know differences between general anxiety and panic disorder.
So very different. So generalized anxiety disorder are what I usually say is people who are born anxious. People who are anxious all of the time. They've been anxious since they were little kids. They worry about their job, and they worry about their family, and they worry about their are they going to get a promotion, and they worry, can I pay my bills, or do I have cancer? They just worry. Panic disorder is where you have these discrete moments that last for 15 or 20 minutes that it's just overwhelming anxiety associated with physical symptoms. Your heart is pounding, you're breathing quickly, you think you're going to faint, you think you may throw up. You have to leave the situation that you're in, right? You feel like you have to get out of where you are. And then you have symptoms of what's called depersonalization and derealization, like you're kind of in the twilight zone. Yeah. You know, on TV or in the movies, sometimes in the old days, if they wanted to show someone who was having a panic attack, they would take the lens and they would sort of like bend it, and it would look like the world was weird. Mm-hmm. That's what it feels like when you're having a panic attack. But it only lasts for 15 or 20 minutes, and no one dies when they have a panic attack, and no one has a heart attack when they have a panic attack, and you don't throw up, and you don't faint. None of those things happen. And actually what Claire Weeks' books talk about is trying to learn how to get through the panic attack and realizing actually nothing bad happens, and you realize it's just kind of a pain, but it's not life-threatening.
Are there people who suffer from panic attacks very often? I mean, how often can they come on?
They can come on dozens of times a day. I mean,
really?
Oh, yeah,
wow.
Sure.
Okay.
So the worst thing that can happen in people who have panic is you start to associate panic with a certain location or a certain activity. And so let's say you have a panic attack in a restaurant, and then you stop going to restaurants, and then you have a panic attack on the Beltway, you stop driving on the Beltway. And then sooner or later your world gets smaller and smaller and smaller, and that's called agoraphobia, where you start avoiding the places that you associate with panic. And I had a patient years ago, a girl who hadn't left her house in 2 years because of panic attacks.
Wow.
Yeah, that's a real extreme, but yeah, it can happen.
Does that happen? I mean, how often, or I should say, how many people is this happening to? I mean, is this a very common thing? Because I've heard of a lot of people say that they've experienced at least one.
Yeah, so an isolated panic attack is almost a universal event, right? People before, I'd say medical students before they take their first anatomy exam will almost always have a panic attack. But men before they're getting ready to get married, right, will sometimes have a panic attack. But, so it's very common to have one panic attack. When it's recurring, that's panic disorder. And it can happen very, very frequently, and millions of people in the United States suffer from panic disorder.
Night terrors, we have a question. Are night terrors considered a mental health condition?
No.
No.
How about that?
Okay.
The night terrors are things that happen to little kids. They wake up in the middle of the night screaming, and you comfort them. They have no memory of it. It's a very, very common problem, and it's not considered a mental disorder.
When somebody has a serious mental episode or condition, I remember talking to a specialist one time who said when we see somebody with a physical ailment, something physically wrong with them, we see it right away, we may feel bad for them, or we may want to try to help them. With mental illness, you cannot see it. And I think that can sometimes make it scary to maybe approach somebody who is having some sort of mental episode. If you were to come across that, how would you deal with somebody?
Focus on the symptom, right? You don't want to label someone that they have a mental illness. I mean, you're talking about as a layperson. If you were a layperson and you saw somebody who you knew had a mental illness who needed to seek treatment, I mean, what you want to do is talk to that person and say, I'm really worried about you. I'm worried about this symptom that you're exhibiting. You're not sleeping well. You're not taking care of yourself. and you should go see your family physician, right? We're the entree into the system for mental illness, right? The overwhelming majority of people with depression and anxiety disorders are actually cared for in a primary care setting. And most of them actually don't have to see a psychiatrist, and they don't necessarily have to see a therapist, but sometimes they do. But it's best to go through your primary care physician to advise you what you need to do.
Okay, and that is a great, I guess, way to end. If somebody feels like maybe they have anxiety, depression, if there's a family member, the first step is to see your family physician.
Always see your primary care physician. We can actually take care of this most of the time. And if not, we can refer you on to whoever needs to be referred to.
Sounds good. All right, anything else that you can think of that we didn't talk about that we want to share?
No, just remember mental illness is a very, very common problem. It's nothing to be ashamed of. There's very effective treatment for almost all mental illnesses. And see your doctor.
Okay. Well, thank you so much. I think we answered all the questions that came through on Facebook Live for us, and we want to thank you for joining us. And thank you. You're so easy to talk to. You make everything just easy to ask, easy questions, and very helpful and very informative. So thank you again. We'll see you next time. Thanks for joining us. Have a great day.